Thank you. We're going to start with a prayer. Beth, would you mind?
Oh, say the prayer? Okay, we'll go to the Catholic one, because that's what's up there.
Well, I don't care, just a prayer.
Okay, all right, so, Father, Son, and Holy Spirit, amen. We'll just do the Our Father. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Forgive us this day our daily bread, and forgive us our trespasses. As what? As we forgive those who trespass against us.
Lead us not to temptation, from deliver us from evil.
Amen.
Thank you.
Well, we did a really good job.
Thank you. I'll have to come prepared next time.
I promise I won't do that to you again. Thank you. I'm sure God understands. So we're going to come to order. And do we have a motion to accept the minutes from the February 21st meeting?
I'll make a motion.
Do we have a second?
I'll second.
All in favor? Aye.
Aye.
I'm assuming that was unanimous. So if is someone keeping notes, I guess?
She's our note taker. She's our.
Just- We're having a day, so. Everybody who's been with me today knows I'm having a day. On the second thing, we did the acceptance of the minutes from February 21st. We had a resignation that was submitted from Debbie Davis. She is no longer going to be working at Memorial, so she has asked us to remove her from the committee, and she has named her successor. Do we have someone who would like to accept this resignation? You want to make that motion?
I'll make the motion to accept.
Do you want to second it? All in favor?
Aye.
Now, the person that she has named, I believe you spoke with, did you not, Deb?
Yes, I did. I talked to her, and Miss Lauren, are you in agreement? Would you like to be on the committee? Sure. Okay. I think that how we proceed with this is that we'll vote you in, and then we have to take it to the Board of Supervisors to let them know that there's been a resignation and that we have accepted you as on the board. And then at the next meeting in April 11th, I believe that's what it is, you'll be able to attend that at that time. So I'll let you know.
So do you want to be in here when we vote?
Huh?
Do you want to be in here when we vote?
Let me step out, you want me to step out?
You don't have to, it's just up to you.
It doesn't matter, go ahead.
Anyone want to make a motion?
I make a motion to have Lauren Colleen, thank you, I don't know how to, Colleen, take Debbie Davis's place on the Blue Ribbon Committee for Child Protection.
Is Debbie retiring or going to another?
Yes.
Retiring. Okay, it's a positive. Okay, well, I mean,
Anyone want a second? All in favor of this appointment, say aye.
Aye.
It's unanimous, you didn't have to
Yay.
leave. Thank you. And that is a 2-year appointment, just so you know.
I'll put it on the agenda for the
Did you realize that?
board.
April the 11th.
April 11th, no, April 1st,
7th and the 14th.
7th, okay, 7th, April 7th.
And then our meeting is on the 11th.
Right. I'll have to put it on the
The
agenda.
11th?
Our
The
meeting
11th is our next meeting.
because of Easter.
We moved it up a couple months ago.
Right.
Okay, so the next thing on the agenda is the legal opinion from the Attorney General update. Carla, I, and Judge Alfonso have all worked on this along with the board to get an opinion from the Attorney General's office. And the request was mailed to the Attorney General's office. They responded with a letter. The Office of the Attorney General is in receipt of your request for the issuance of an official opinion received on March 14th. This marks the receipt of it. So unfortunately, you have to wait after they do it, after they receive it, up to 100 days, okay? So, we wait.
Kim, tell the audience what the opinion was, because I know we have some new folks here.
The question was whether, and let me know if I get this wrong, because I'm working off memory because I don't have it.
What the board, what the members have been told in the past in their work capacity and individual capacities is that just a baby being born positive for meth or cocaine or fentanyl is not sufficient to place the child in custody. And so we are asking for an official opinion that, yeah,
So you
And
have
that
heard
they're-
that too?
So
Well,
there's,
we
I
do that every day.
custody,
Yeah, we have babies positive fentanyl every day, and they're like,
And
it's fine.
so there's a Mississippi law apparently that says that you have to have both, but if you read the law, it makes it seem more like that's for marijuana.
So
That
we asked-
marijuana alone is not enough, you have to have a
Mhm.
second thing. It doesn't actually mention, the harder Schedule I drugs. And so that's what we're kind of getting their professional opinion on.
So we asked for cocaine, fentanyl, and meth.
and then did we not include
I
all
think we
Schedule
included,
I?
yeah.
Those were
Sorry, you said-
named separately,
Yeah.
yes. And then,
But they were named separately because those are the three big ones that we see.
and then harm occurred due to this, not just the presence, but we also asked if there was harm that occurred, was that going to be enough too? So it was a multiple thing of questions, not just one.
We just wanted an official opinion from the Attorney General's office that, yeah, a baby born positive is sufficient to initiate protective services.
Yeah, because that law only mentions marijuana.
It only mentions that.
Excuse me,
I
one
think
sec.
it's been too broadly.
Yeah,
Sure.
Well-
it's being interpreted for all drugs.
Right, and you know that, we all know, sitting here in this room, that if a baby is born with fentanyl, that is harm.
Or methamphetamine.
I mean,
And that it's a riskier environment for that child
right,
to
well,
return to.
any hard drugs,
I'm wondering if, I'm seeing something for the first time that I have not seen. Those are the toddlers with meth mouths. Have y'all seen any of those? In other words, if the mother is still nursing a child.
and then she's doing meth, and she's nursing.
Oh,
And
I guess I don't know how you can delineate that from like bottle rot
Or like,
just
poor
not
hygiene in
brushing
just
your
general.
teeth.
hygiene,
Yeah.
okay,
And I don't know if you can differentiate that.
okay.
We have, FOC has cases, Friends of Court has cases where the kids, children, toddlers are testing positive for methamphetamine. We just had one test a couple weeks ago that turned in a positive result.
well, hopefully they will get us this opinion sooner rather than later. Did anybody have any comments other than what's already been discussed? Questions?
What, well, I guess this is jumping the gun, but what would the committee do if we get an opinion that says, yeah, that's sufficient to take action?
My opinion would be to immediately send out, to do several things. One, to send
Press
out
release.
email to.
It's a good way to.
A press release would be
A
good.
press release, Valerie?
Yeah, absolutely. Well,
Notify
you know,
all
you
the
guys
state-
need to let me know if,
Oh, we'll let you know.
let me know. Yeah, because we can draft something up,
Mhm.
definitely.
I think we also need to send a letter to the state legislatures going, here, you need to be aware of this too.
And we would have to let Andrea Sanders know.
Now, isn't she coming to me?
Yes.
She will be here, the head of CPS will be here on May 16th.
Yes.
So please come to that meeting and broadcast it out because we,
Should I put out a press release that she's
Yes,
gonna be attending
absolutely.
to the-
Yes.
Is there a bigger room in case we need more space?
Because I'm gonna have media come too.
oh, that would be fantastic.
Because I know there's a number of like the nurses that I work with that
Are
want to
going to
come.
Um,
Yeah.
I think this is the biggest room, isn't it? Here at the,
We've had lots of people in here.
Okay.
Yeah.
they can stand and,
Have y'all heard from her anymore? As in-
well, she set the day. I mean, she knows that that's when it is. She agreed to that date.
Maybe we're gonna get disclosure questions to her first.
Yes,
so she
I-
have a chance.
No, it'll go
Right, and
We'll go over that, I guess, in a minute.
Uh-huh.
Okay, we'll go over all that.
That was actually the very next thing.
Valerie, did you have something, honey?
No, I'm good.
Oh, okay.
So May 16th, Andrea.
Yes, ma'am. She's gonna have a working session, we're having a workshop with her in the morning at the Advocacy Center, is that correct? And then,
But just the committee with her.
yeah, just the committee. Then she will attend the Blue Ribbon meeting, at 1 o'clock, and she'll be open to any questions at that time.
And we have a list of questions that have been submitted by the board. And if you have a question that you would like for us to submit, please get it to Jenny.
Are y'all
But we'll
doing
also
that?
have an open time for
Did you-
questions at that
Did
meeting.
you wanna see some of the questions?
Yeah, I didn't see.
Oh,
that.
here, you can have this, Judge.
Anybody else I have?
Are y'all inviting TV and whatnot?
I'm gonna get, yeah. I'm gonna get WLS for next Steve, and Sun Herald too, I'd like to get
Yeah,
that
you need to, you need to just broadcast it.
everywhere, yeah.
That would be awesome.
Yeah, Judge Alfonso, if you have anything that you would like to add to that, just pop me an email.
Yeah, I can keep this.
Yeah, yes,
Okay.
yours.
Did anybody else want to say? Yeah. I have a copy right here.
I can see what you-
Now, I'm looking at number 12.
What does it
on
say?
this, it just popped out. There was something in the legislature about kinship care, which is, Bev knows what that is. I don't know if it passed or what happened on it, but it was brought up again in the this session, kinship care.
Do you know what, you don't know the context of it?
No,
I'll look into it.
look it up, because it made it out of some committee, which was shocking since it never has before.
And everyone has the date for the workshop down.
What are y'all seeing for like, knowing, because we're having a lot of issues of like, we've been lucky, I guess, but like on day of discharge, we find out basically like whether it's an anonymous call or somehow I can't, like that, like they'll have 8 other children, but then you realize they don't have custody of them. And so,
But we have no
we,
way of
knowing
knowing
that,
that.
they say they do, they'll give their ages and then however.
We're just like, okay. you know.
And then,
And if they have care too, there's no red flags to say, it's not like a drop-in where you're gonna get a UDS and, cause we don't have that policy.
Like,
Like,
so
we
then they
don't have
almost like
universal
hold it
drug
over our
screening.
heads that like we didn't get a UDS and, yeah.
So
it's
explain
like-
what y'all are talking about when it
So,
discharged.
like,
Did you maybe want to
we're
introduce
like,
yourselves first? so
Yeah,
everybody
please
knows?
stand
Sorry.
up, yeah, please stand up.
I'm Austin, this is Courtney, we're the nurse practitioners at Singing River Health System. So we cover the nursery in Ocean Springs and Pascagoula,
Welcome.
sorry, yes.
Okay, tell me what y'all are talking about.
So, baby's going home and say.
Baby's going home.
Like
So,
newborns,
yeah.
newborns on day of discharge. So like when the mom comes in, say she has care, so we don't do universal drug tests. They usually will grab a drug test if they had 0 care and they're drop-ins really.
delivery.
And so, how late was the last time we found, it's been on like day,
One time, a relative called, like anonymously, and was like, hey, I just wanna let you know, if so-and-so is there and delivered her baby, she is doing meth her whole pregnancy and blah, blah,
we
blah.
have all of our kids, like their family, and so before we called them out, we called Alabama CPS and they like have the court, you know what I mean? So those kind of things, like where we're finding out that the mom doesn't have custody of any of our other kids, had positive drug screens there, and but then, you
Pregnancy.
do the CPS case and they're like, we don't have any issues, all good to go, those are the kind of like, because some states, if they've taken the other siblings, that's reason enough to like
Right.
open a case, but that, they don't seem to do that here.
Well,
Well,
they
I'll
used
tell you what we used to do.
yeah,
Um,
go ahead.
When I was youth court judge, when we had somebody that's child was in custody and they were pregnant, we did a protective service alert
right.
to the hospitals to say, take the baby.
And we asked
Do y'all
about
do
that.
that anymore?
I don't ever get those
I
emails.
just
Do y'all
asked
ever
them
get
about
protective
that.
service alerts?
No.
That's something you need to ask Andrew.
And I was
Why are they
told-
not doing protective
I
service?
remember
If they
alerts?
had
But
to
we
do that for everybody, it would be too many to
There's a
do.
reason those, we were
was like, well, you know, we used to get like flyers, hey, look out for this person, you know.
I remember those, we used to get them all the time, we don't
Yeah,
get, we
you
don't
don't
get
get
that
stuff.
stuff.
We'll sometimes get them from Alabama.
Protective service
Build
order,
it,
you know, when,
Oh,
Do you know-
probably. when
But
she
that's in
left.
Pascagoula, we're not gonna
Yeah.
get
Used to be
one
true.
from Alabama all the way to
Yeah,
Ocean
there's a-
Springs, that's just too
There's
far
a
right now.
direct correlation.
Do y'all, the committee has made a lot of progress in the sense that Memorial has
Yeah, so
much better.
we've been working on that, we've been hammering that out, and kind of, this is kind of the next phase, is to start bringing you guys in and other hospital systems and stuff to try to spread the love and get
Do
some
y'all
of what's
have a
worked for us
contact?
out to everybody else.
For like,
Do y'all have a contact person at CPS or youth court?
yes.
Who's your contact?
So we talked to Katie Frazier a lot.
Who is that?
She's like the intake, like the,
Her official
like
title.
the
At youth
intake
court?
officer, but yeah, at youth court.
in Pascagoula.
Oh, it passed.
Yeah,
through.
they're
Right,
from
'cause this is in
Ocean
Harrison
Springs.
County, yeah.
They're from
Right, but
Ocean Springs.
we got interested in this though from, we don't have any contacts with the Harrison County Youth Court.
Yeah.
We do occasionally have Harrison County babies in Ocean Springs, so, and we've just been interested in general, having, being a part of this.
How to.
Well, you need to be part,
And you're
because
just
we
up the
can,
road, you're
right.
just
Better,
yeah.
yeah.
right, absolutely, we can help.
So,
And
yeah,
maybe
we've
you
started
need
here,
something
now
like
we wanna
this.
start branching out,
Yeah.
so, yeah, we're happy to have you here. Thank you, we're happy to be here.
Yes, we are.
So y'all are not sending River up, see, I get the hospital and stuff.
So we're
It's
in
not
Ocean
Garth.
Springs, but the Gulfport one,
No,
they stopped
Gulfport,
doing
no.
newborns there, so.
So now, does CPS ever, include you in their safety plans?
Not
No.
by their will.
We have, no,
We have to basically force the parents to.
yeah,
to
we
show us
force the
copy.
parents to show us the safety plan.
CPS says it's confidential.
Okay,
and-
so
They
They
won't
we have
show
the
it
same
to us.
issue, and we're looking towards trying to get like a court order that's standing for every single one that's opened by the hospital, that they have to show that within 24 hours of discharge, so that we can make sure that everything, all of our concerns are addressed.
Because that should be, all of the hospital's concerns should be addressed in the safety plan.
Right.
Right, and if it's not, then it needs to be. So we're trying to, Robert Jones, who is the.
Yes, exactly. So how are we supposed to know what you think the safety issue is? You know what I mean?
Right,
It's like
no, exactly.
confidentiality that they're
Exactly.
saying
We're totally with
is
No,
blows
we-
my mind because I'm like, I can't sleep at night knowing
Yeah.
that
Mhm.
we're just sending these kids
Right. Right. Oh,
and they're getting lost.
We
can't
agree.
get to find them
That's
after
right.
discharge.
And you tell them, you're like, okay. I'm like,
They're in a different state.
Jackson, Alabama,
versus
Jackson says, hey,
Katy.
they no-showed to their appointment. They told the healthy, because we do the Healthy Moms, Healthy Babies too. She's helped us with all that. And then I'm like,
Yes.
they said that they're going back to Jackson, Alabama. And he's like, I know exactly where they are. They're in Jackson, Mississippi. I was like, they're in Jackson, Alabama. He was like, what? Like he thought that they were in and they were a whole different state. And I've never heard back after that. I'm like,
You know,
who knows where they are?
We just had lunch with school officials for Harrison County, and they said so much the same stuff that you were saying right there about the confidentiality getting in the way of taking care of the children. So, yeah, it's almost like listening to an echo of what we just heard. Yeah. It is the exact same problem.
Are y'all any closer to getting to be a part of the safety plans, the hospital, is that any?
We haven't at the moment,
Remember
we're still
Robert,
working on it.
remember Robert was supposed to have something to us before this meeting.
And I don't see
Very
Robert.
Like coordinating the safety.
Yes,
plan
what
with
we
them?
have
Yeah,
asked,
like
Order.
addressing
Judge,
what
a
needs to be.
standing order.
Okay.
To
All
make
CPS
it-
cases from the hospital, that those safety plans have to be shown to the discharging physician.
Right, so if we can make it kind of like a universal for all the hospitals, that this is the procedure for the
Yeah.
safety plan and include the hospital.
But you'll probably need your local judge to sign off on
So
that.
how did that get started? Because
Who?
they used to, I feel like there was no issue giving us a safety plan like a couple years ago, I feel like. I feel like this is a newer issue, for us at least.
Maybe it's judge by judge, I'm not sure.
Okay.
I don't know.
I also feel like they weren't really doing safety plans. Back then they would take
Well,
custody.
they were
Yeah.
more taking
Yeah.
custody,
Yeah.
yeah.
Yeah, I mean,
home
they have
hospital.
custody, there's no safety.
So,
plan.
Yeah, it's a new
probably
thing,
why.
I think it's a new thing.
Yeah, I don't recall ever hearing the term safety plan.
Well, I tell you when it started. I think it started back like in 2018, 2000, yeah. Because when I came back to CASA, suddenly, I think a year or so after I came back, they used the safety, and I go, what is the safety plan? And they go, well, so we can keep the kids in the home. We've outlined these kind of things that, you know, the parents, they have to have a job, they have to have housing, and this, and, you know, just very minor things. A safety plan, they have to comply with that in order to keep their children.
Yeah, but again, the safety plan may be giving the child to an aunt, and then they just go away. I mean,
Exactly.
Oh,
You
yeah.
know, because they're like, well, they're going home to the aunt. We're like, no, if you're not taking custody, we're not dishing up. We can't just
Right.
say,
We have that
take your word for it.
and then
Home
they
with the
just
aunt.
give the kid out the back door back to mom.
They're going to do
Or
that to
they're all
the
living
mom.
together, or,
Yes, and they're all doing drugs together.
One time they told me, they're like, well, her hair follicle's positive, but we think it's just because she's around it. I'm like, well, that means the kid's also gonna be around it, which is an
That's
issue.
right. That's right. More and more kids are testing positive for you know, illicit drugs, marijuana, meth. I've seen a lot of meth.
Cocaine, we had a cocaine.
Cocaine. And the residual, that is worse because it's just in the air and you can't it gets all over.
Yeah.
Especially methamphetamine because it's such a fine particle. I guess this is what Keith was telling me from ASAP, that it's such a fine particle that it's hard to get rid of. You know, if it's been smoked in the.
What can the committee do? This safety plan thing, incorporating the hospital is huge. I mean, they know what needs to be a part of the safety
Right, well,
plan.
you know, I'm gonna call Robert.
How can we, I mean,
I'm gonna call,
he's supposed to be here and he's not. Well, what enforcement does the committee have where you were supposed to do this on such and such a day and you hadn't done it?
Well, I told you.
But I feel like
Robert
Robert
recently-
said if the judge gave a standing order to share them, that they would be more.
Yeah,
But he
I'll
also
call
said that he thought they were already doing that, and he
They're
didn't
not
see
doing
a
it.
problem with it from a legal standpoint.
Right.
So
I'll call
why do you
Robert.
need a judge's order if he's
Right.
fine with it?
yeah, I'll call Robert.
So has Robert changed positions?
No,
Because
he's
he told me now he was over Pearl River.
Oh, I don't know.
So I think he's over Pearl River too.
No, he was saying that, because we were talking
So will
about.
they not show
policies,
you the
and that
safety
he's over
plan?
Pearl River.
Which is ludicrous because you're the charge hospital that's taking care of this child.
Do they tell the parents not to show you?
I don't know if they necessarily do
I
that.
think
but
they
we
tell
don't really
not
strong
to.
on
We did have a
the
Yeah.
grandma that brought us one.
What is
She
it?
thought, we had a grandma that brought us one because
Yeah.
she thought she needed
Didn't
to.
know
I
that
don't think
she,
they're telling them
because that
not
just
to.
would seem normal
Yeah.
that, you know, the hospital would need it.
Tell them the one you saw didn't address anything.
Oh yeah, it was a cocaine positive, and they did take custody, but the parents lived with the grandma who was getting the child in safety plan, and it never addressed the drug positives. So I was like,
Yeah.
what are you doing a safety plan on if you're not addressing
Yeah.
the concerns? And that's what one of our biggest things is, we need to work together
Yeah.
on these to make sure
Yeah.
you know all the problems.
And I'm like, we'll check in once a month. I'm like, oh, that makes me feel great.
Because if there's no documentation on their end of our concerns, they're gonna be like, no one told me. They weren't
We found
informed
where there's
about,
been
you know.
breakdowns in our communication
Yes.
to them. We have found going through systematically where we have been missing the ball on some of the stuff that we were concerned about wasn't getting transmitted to CPS. So that's been some of the stuff we, you know, it's not just been a one-way street. You know, like there's parts where we've let the ball go too, where we didn't realize it either. So that part's gotten better. We're happy to share all of this with
We
everyone.
don't really
Every
have,
hospital.
we lack in social work, we don't really have, like, our pediatrics, like the back burner, so the social worker, you know what I mean? So we just contact CPS, like, so we constantly, we blow
We're
their,
the one.
like, blow their phone
Okay.
up, then their supervisor, and their supervisor, and so I always get their name, I'm like, so I want you to verbalize, you're saying, you know we're positive, we're fentanyl and meth, and this is your number, and they're okay to discharge. They're like, yep, I'm like, all right, put them a note when I go to court. But, yeah, it's just.
Who's
And
making
it-
your reports, like, in their system? Who's making your reports
do.
to CPS in their system?
I think Memorial does social services.
Social services.
Well, yeah, that's normal,
So,
hospitals do that, but we don't really have that option, so,
The nurse practitioner.
We,
yeah.
Holy Cheryl, one time we spent hours calling every homeless shelter in the state in Alabama, and then ended up calling Miss Cheryl because
Because CPS said we could discharge this baby home with a homeless mother.
to attend.
She had no
Who
home.
had MCAT, by the way, so I'm like, she can't go 3 hours without eating.
Okay, hang on.
They said
So-
it's not,
Neglecting, it
if
says,
it's, if you're
poverty is
homeless,
not.
yes.
Can you repeat that? I, say it again, please.
So we were trying to discharge this baby who took no home. The mom was homeless. Parents were homeless, and they had another kid also
They were all in
who
the
was
car.
staying in the room the whole time with them. And we even kept the baby extra, like, longer because we had to, because
The
the,
newborn screen was positive for like,
an inborn error of metabolism.
Metabolic disorder where the
So it
baby
was
cannot
gonna-
fast. The baby
Yes.
fasts.
cannot go, they're like,
dies.
the board of health calls, like, this baby cannot go more than 3 hours without eating, ever.
It's
Or
very
he'll die,
serious.
basically.
Very
So we
serious.
kept it till the confirmatory came back. Gave him all his time, still nothing.
We spent like days calling homeless shelters,
And if you aren't like domestic violence or on drugs,
Yeah.
they say sorry.
and she was neither of those. So I thought about just saying, yeah, she is, because,
Yeah.
you know,
Such a
but,
medically fragile child.
Mhm.
and so, yeah, and so they were like, discharge them.
To the
CPS?
car,
Are you saying
Yeah.
CPS?
Yes.
the car.
And so I, out of desperation, called Cheryl Bell, because I'm like, this is gonna be an infant mortality, and I feel like you need to know about it. Help me do something, I don't know.
I have a question for you, Judge Alfonso. We hear this stuff so much from nurses, medical care, the teachers and everything. Do the judges know what's going on, and why can't they take a more active role in trying to get something changed?
But once again, we don't have an investigative tool, that's why FOC was created. All we can do is act in court. They tell me to make hotline reports, I make hotline reports.
Y'all
And
have a
that- I mean-
Facebook group that says judges are us,
I mean,
and y'all can talk to
They
each other.
typically write just like I do when I talk to them about it,
Uh-huh.
but we do courtroom work, we don't.
They're not in charge of family, youth court.
Yeah. I
Yes,
mean,
it's a youth court thing.
Yeah, but it
It's a
seems
youth
like,
court. The agency
review of
charged
some
by
sort.
law is CPS with taking care of kids. That's the agency entrusted with this. That's Andrea Sanders.
And one time I asked about it, and sometimes it's not even getting to the judge, because the CPS, they'll close the case before the
that's
judge
what
ever
I'm
hears
thinking,
about
is
it.
that a large number of judges don't know what CPS is doing.
They'll close the case, and one of the ones that also homeless, they were in a hotel. I asked them, what's the status on this one? They're like, oh, that case has been closed. I was like,
So if there's not, at the judicial conferences, if they're not having a conference and talking about the things that are occurring with CPS and just letting people know, we're trying to notify the community, but the court system, the judicial, the law enforcement, they all need to know too.
Well, I think they do. I mean, it's, what do you do? I mean, that's what y'all are.
We're trying to find a way.
And so what I'd like to come up with is an action plan to get a doctor as to be part of the discharge, the safety plan, to address why the child's in the hospital, to protect the child. Something's got to be done about that.
Yes, Judge, we've been talking about this, we've been talking about the safety plan for the last 4 months, and it seems like we're just, Beth and I were talking about this, it's exhausting trying to get something in place, and
Why don't you
And that's
invite
so
the youth
hard.
court judges to come to one of these meetings?
That would be
Because-
wonderful.
yes.
Because it's such a simple thing to say, can you make the hospital,
Because, yes, they might not even know what's going on that they don't know about before it
I
gets
think that's
to
a great
them.
idea, we'll plan on doing that. Let me ask you, so I'm curious, what happened to that baby, Cheryl? What,
it went home, so they finally found at the last minute a
A relative.
relative who said they could stay for 30 days. And CPS, instead of taking custody, they hired someone to call the mother every 3 hours, to FaceTime the mother to make sure that she was feeding the baby. Eventually they took custody, obviously, because the 30 days were up. She said, you gotta get out. Nothing had changed, so, but it took that long.
and they did a FaceTime, and they 100% knew that she was feeding the baby every 3 hours from a FaceTime thing.
Right. But we were, you know, they call it prejudice.
I
They're saying,
agree,
you know,
yeah.
you know, being poor isn't neglect. I'm like, we wanna help, we're the ones who called everyone in the state trying to find help, you know what I mean? Like, we just want what's best for them. She's a very sweet lady, but like, what,
I'm like, we weren't even
Don't
saying
they have to-
custody.
don't
I
they
even
have to have
told
an
the lawyer,
address?
like,
Don't they have to, Judge Alfonso, don't they have to have an address, the child?
They're supposed to.
They have to have a physical
now
address.
the law says homeless.
What
is
law?
not,
that's
We
what,
looked
there's like,
it up.
I think it's
some
like,
law.
on like,
Who said?
it says like neglect, is like by poverty, whatever it is like not
Poverty
having
is
the
not
means
poverty.
alone without showing that you've not tried to use
Yeah.
state resources to fix all the, like, there's a new, it came out like
Yeah.
in July or something, I had to hear about it from CPS.
They come up with something.
Can
stuff
you,
I've never heard of.
seriously,
We can pull it up.
Austin,
Yeah.
can
Yeah,
you,
Tracy,
can
it's like
you
something
tell us
about-
what law that is? Cause I, Beth, have you heard that?
What,
The
about
new law?
the new law?
Well, poverty has never been an excuse
Right,
to take
so-
a child.
Yeah, but,
You
but
know,
homeless,
into
but you
custody.
can't,
But you have to have utilities.
you have to have an
food.
address. You can't,
Can't provide adequate
You
care
can't-
with
Yeah.
all
That was our thought, yes. We were like, how does
Particularly
this
a
make
medically
sense to
fragile
you?
child.
It's free, it was also gonna be the coldest day of the whole
Yeah.
decade, yes. Like,
I'd
coming
like
up
to know
and-
what law this is so we can look it up because I've never heard of,
Well, again, what can y'all do? Because we keep talking about
we
this.
can keep talking about the same thing and hoping that
Something
Robert
changes,
is
but it
going
doesn't-
to
And we
communicate
rely
this.
on him, and I
it's not
hope he
going
watches
anywhere.
this. Every time he says he's gonna do something and he
I'll
never
call him.
does it. He never does it. Does he?
No.
He's
I
the
think that inviting the youth court judges of Harrison, Hancock,
And Jackson.
Stone, and Jackson, yeah, all coast up.
Maybe, y'all should have a workshop with them first, privately.
That's a wonderful idea.
That's what I would do.
Gonna
What
workshop
y'all-
everybody,
And what, you know, for, like y'all did
Um,
today with the schools.
That worked out really well.
Did it?
It really did.
Is it, you're just hearing the same thing?
I can talk with David someone, I don't know.
But their reports that they see with their children coming to school, I guess.
Well,
and
they
have
can't get
concerns.
any information, so then
Yeah.
they worry about did the child get taken into
Yeah.
custody, did it just disappear, what happened?
Oh, I have all,
Yeah, she's on
maternity leave. I have all their contacts.
That, but I'm saying that was the only one I
I love that website too.
Well, write it down, Jeannie, so we can look at is it a statute number?
have. Look at her face.
Are you serious? Let me look at this.
Yeah, I felt when CPS.
It's a universal citation.
What's a universal citation?
To be used anywhere. Mississippi Code 97.
No, it's down here, here it is.
No, what I'm talking about right here.
Oh.
This is the statute number.
Right.
Right
Write it down, Kim.
Here, I'm gonna take a picture of it.
Oh, yeah, that's not your phone. I was gonna say, take a screenshot before we're doing a picture of us.
Yes, this is,
75, Done in 2024.
What does it say?
and
What does
then
it
it's,
say?
you want me to read it to you?
Mhm.
Okay.
Is it a statute?
Yeah, but it's
From
the
2024.
universal, okay, here it is, it's D, it's number D. If the parent has failed to provide the child with food, clothing, or shelter necessary to sustain the life or health of the child, excluding failure caused by financial inability unless relief services have been offered, and refused, and the child is in imminent risk of harm, or the parent is unwilling to provide reasonable necessary medical care, though that medical care does not include recommended or optional vaccinations against childhood or any other disease, the person may be sentenced to imprisonment in custody of the Department of Corrections for not more than 5 years or,
Well, that's a criminal statute.
yeah, that's a criminal thing.
Yeah,
It's-
that's a criminal statute.
But is that part in there
It's
that
not.
says?
Or
and
medical,
all
I
of
mean,
it,
the
and they
medical
can't
thing
get
was
them all?
yours.
So it's
Yeah.
not even a matter,
Yeah, that's a
You're
criminal.
covered by medical.
You're not trying
underneath there.
It still says
Yeah,
in
I'm
all,
just trying to get.
that's
get
where
my
they're-
baby into a safe
that's
environment.
where
This is
they're
Mississippi
understanding.
Code, we meant.
Well, just sit
Just-
down and let's look
Universal
at it.
citation just means that's the citation that's
Yeah.
accepted across the country.
Yeah.
But
So they're saying something that may not.
I mean, I agree with just being poor
Right,
is not
well,
a
yeah, we
crime.
all
Yeah,
know
that's
that.
the law.
Yeah,
Yeah, just being poor, you
Right.
provide services. You-
Yeah. But
but the intent of the law
were they
was
trying to
not
get
for what
services
they're
and were
doing
being
right
denied, or they're not even trying to get services? I guess is,
You tried to get on.
because if they're not even trying.
We tried.
You didn't refuse it.
They, I don't know, did they have a phone even? I can't remember.
They did, but the phone kept good, like, it was like take out
So,
a week.
once again,
So y'all are gonna plan a workshop?
Yes, yes, I have that in my notes.
Dr. Caldwell has graciously volunteered to head that up.
Because she's amazing.
She's been strong-armed into it.
You know, instead of having all of us there, you know,
Huh?
at the workshop, because this safety plan thing is enormous.
So you want this workshop open?
Not
No,
the
no,
workshop, y'all.
Yeah.
Yeah, see, I was gonna say, yeah. Yeah, just like
So
the
they're
school
not
at the
attacked
end
by
of it.
us.
Right.
Yeah. Then we'll bring our findings back.
Yeah, when do y'all think y'all can?
I don't know, Judge. My calendar's
We'll take a baby
really,
step here first.
Yeah.
Let's start with
my
just reaching out.
calendar, we're gonna have it
I mean,
probably
maybe
after,
May.
no, it has to be after Edry and Sanders in May. 'Cause
So
Edry-
that would be after May 16th.
Mhm.
So maybe something in June. We could look at it.
Because Beth is gonna be gone, aren't you gonna be gone too? Oh, so probably, maybe we can have it on in June, maybe?
I'll start by contacting them and see how far I get.
There you go.
We'll go with that.
Do you want me to just email you the contact information?
That'd be wonderful.
Okay.
Yeah.
I'll just-
Of Stone, Harrison, Hancock, and Jackson.
Uh-huh. Now, do you wanna, Stone has a referee. They don't
Right,
have-
Sean.
Yeah, okay, so.
Well, he's basically the
What
youth
about Pearl
board.
River? Do you want to include
I
that?
think Pearl, I don't.
I think
that's
just
too
the
far.
code, just,
Yeah.
So, who was it that sent me a message the other day that they were going to change Chancery District 8 to include,
Well, they're talking about redistricting,
So
but I
Stone
don't
wouldn't be a
know if
part
that's
of it.
ever gonna happen.
okay.
Well, we just make the parents show us the safety plan and
that's a good idea.
print it out.
But you're not getting it until the baby's walking out the door, and then you don't necessarily have a chance to have stuff amended, I guess, is.
Yeah, that's true.
why
Well,
So
I
I'm
tried
then,
to
as long as
understand.
everything is
Yeah.
like,
we're trying to push for
We're
CPS
trying
to
to
give
get
it to
on
us,
there.
so we can be
That's
like,
true,
hey,
yeah.
before this goes to the parents, we need this
Yeah.
fixed, or you
Yeah.
need to add this,
Yeah.
or.
Well, the hospital should be included in the
I
safety
agree,
plan.
yes.
Because they can identify things that maybe CPS doesn't even know, that they're concerned about. You guys are
Did
concerned
did
about.
Robert not say at one of these meetings that the hospital had the right to call and
Yes.
find out how the
Yes.
baby's doing? Or is that taking place at all?
So that's after the
Yeah.
fact, I mean, I
Yeah.
guess we're trying to make sure that that kid's going home to the safest environment possible.
And if we don't have any kind of satisfaction, then we will ask Andrea Sanders on the 16th of May.
Yeah.
Why this, why
Can't we be involved?
can't we involve, why the hospitals, whatever hospital says, be involved in the safety plan?
Do you have that in your notes to add to the questions? For Ms.
And
Sanders?
the protective service alerts, why are they not being done anymore?
I'm
I
sorry,
mean,
what?
The protective service alerts, when,
Yeah, I don't understand that.
Yeah,
When-
multiple children.
Yeah, Beth doesn't know when it was removed, and you don't,
when
and you
we had a
guys.
pregnant person
don't get
and we
them
had their
anymore.
other children in custody,
but we
we
used
did a
to.
protective service
It's like
alert.
when they
And the
had-
hospitals really liked that,
Yeah.
because they were on alert.
Because
so-
we
Yeah.
don't have any other way of knowing.
Exactly. Yep.
So,
You're right, it's
Morning,
always on
Desiree.
that day of discharge, you find out all that, and you're like,
Yeah.
what am I supposed to do?
yeah, and you have no
Yeah.
drug screens on anyone, and then so you're like, well, all my evidence is out the window, and
I went and found, the youth court law, because I went back to my text. It says, a child shall not be considered neglected solely because the child's parent, guardian, or custodian has failed to provide child with food, shelter, or clothing necessary to sustain the life or health of the child when the failure is caused primarily by financial inability, unless relief services had been offered or refused and the child is in imminent risk of harm, which is like you said, it's an imminent risk of harm. They were saying,
wasn't.
yeah, I'm like,
And we were saying, yes, it is. We are the medical
Yeah,
people telling you, yes, it is. And they still,
and that, yeah, it specifies that they have to have declined help,
Mhm.
but it doesn't say anything about have they tried to get help. Here's the next side. They have to, should be showing like an active,
and
they've
then we're
tried
like,
and they've been
so what about
denied,
the other
right?
kid also?
Not exactly.
You know, like there is another kid in this situation
Who
too,
wasn't in school.
and you don't even care about them
Who should've
either. Like,
Right.
You know,
The committee used to have CPS here, they don't even come anymore.
Oh, This is the only meeting that Robert hasn't been to. Well, he's been the second one. But he was here last time.
Was he?
You weren't
I mean,
here.
I was here the last time, I didn't remember seeing
Yeah,
it.
he was here.
I watched some of the meetings because I'm a big nerd, so I've seen him on some of the meetings.
I've done.
Okay, so
He just keeps telling.
Do y'all
Oh,
know
these
who
are
we're talking
videoed?
about when you say Robert?
No, he's the person from safety, because I remember y'all asking about the safety plans, and he's like, I don't.
Oh, you've seen our videos? I keep asking about the safety plans.
Yeah.
Well, I'll take charge of that one, and I'm gonna,
He was supposed to give
Was
us
there
some
any
He was.
takeaway from
months
the
ago.
Months
meeting this
ago.
morning
I don't
with
think
the
we're gonna go.
teachers? I mean,
No.
what did y'all, was there any plan in the future to work with the schools? I mean, what was?
Oh, you wanna
the
know what-
action plan?
It was
Okay, you
more
think-
like a gathering of info, just like with the law
Today.
enforcement.
Yeah.
They came-
we had, what, about 9, 12? I can't remember. We had Biloxi,
Counselors?
we had Biloxi represented, we had Pass Christian, we had Harrison County. I think that was it, wasn't it? Gulfport wasn't there, and Long Beach wasn't there.
Yeah, I think there's about 8 people.
Yeah. So they were, I think the things that we identified were that they would like to see procedures on what exact information that CPS needs when they come to the school.
What they're allowed to
What they're allowed to disclose, and, because they're always wanting, information, and the school, they want to make sure that they're not breaking the privacy, and protecting the identity of and the information of their students.
And they wanted
So-
a new they wanted a packet provided
Yeah.
from CPS that had the information that they need, so that they know
What
whether
to
they
ask,
can
yeah.
release and what they can ask. They wanted a new form for reporting that would allow them to make attachments on
Not a new,
narratives.
on the online.
Yes.
Online,
The online
they
report.
said that the reporting tool that they have online, the form is just too cumbersome, it just takes too
Well,
long.
it's redundant.
Yeah, it is, and it does, and there's no area on there to attach photographs
Or a
the-
narrative.
no, there is narrative.
No, she said it used to have it where she could write one.
A
There's
bigger
not
narrative,
now.
yeah, now there's multiple
So,
questions.
Yeah, so, and I thought the photo thing was excellent, because, it would be nice to attach, physical abuse of the photos. So those,
Sounds like at the
those two-
moment, the nurses are they're being forced to kind of use their personal phones or whatever to take these photos. So it sounds like they should probably be assigned an actual camera that is, the school's camera to be doing that stuff on too for safety, for the, yeah. And then, having a way to upload those actual images right to the initial report.
And they wanted to know when they could turn over grades and attendance and stuff, if that would be at the initial or wait, because they're not being provided with an order that says here.
Right
you
on
can
the
provide
Yeah, they don't have a
initial
question.
contact.
Say that again.
Well, CPS really doesn't need a court order.
No, this is things that were brought
Oh.
up. So, on the initial investigation, there were concerns about violating the privacy of the children and the parents by providing more information than was necessary for the investigation to be started.
So in other words, if the report is about physical abuse, they don't think that they can get out attendance and parties and
That's
Right
exactly-
off the bat, yeah.
that doesn't make sense.
It doesn't make sense.
It's the big picture.
It is, because
So
if
some school
they're,
boards are providing it, some aren't, because they feel that maybe we need to wait a little bit on some of that info until we have that court order for it. So it's not that they're unwilling to give it, they just want to make sure they're
Well,
their backs, covered.
Well, I
You know,
think-
that's really interesting.
I
So if we had a standard policies and procedures of this is the information that we are expected to give off the top, I think was signed off by a judge or something, everybody would feel more comfortable.
But if CPS is investigating, they don't need a court order, do they, Beth?
But again, what they're saying, if the report is physical abuse, they're
Right,
looking
you
for
remember I
bruises.
asked that
Well,
question.
physical abuse, they're missing school days,
Yeah.
their attendance,
Well,
their
that's what they're
grades,
saying,
their
they can't
grades,
get out.
their
They're
grades go
saying-
down, all
This
those
is on
kind
the
of things.
initial.
Yeah.
If it is
Just the
substantiated,
initial, yeah.
then they could come back
No.
and get
Yeah.
further information and do a more thorough
They don't do-
investigation. They're worried about violating the privacy of the child, and that's a legitimate
that-
concern.
That doesn't make any sense to
Crazy.
me either.
No, because you need the big picture.
Yeah, you do.
Yes, because that's
Why can't they
gonna
be-
make the
So, but if
investigation.
they had a standardized
Yeah.
packet, then everybody would just follow what's in
That's
that rubric. So maybe we just need to help them get something standardized.
That, I think so. Would that be an Andrea Sanders question?
Probably.
They also mentioned that after they have submitted it, there's no way of getting a copy of it. So they have to do like screenshots and stuff like that before.
They hit
So
the
maybe
submit
making
button.
some way that once you've submitted it, there's a PDF that pops up that you can print or something.
So you have a paper
So you have a
trail
copy
of
for
maybe
your
the
own
report?
records. Yeah.
And then they never know the outcome, they cannot get updates
Sound
on
familiar?
when they do their reporting, they don't
Yeah.
They
There's
don't know
a
what has
you
happened.
click, it says get updates or whatever, but
They never do. And so then one example they brought up was that, they just put in a report and now this child is not showing up to school
Right, now
anymore.
they're all worried.
But
Which
now
was
we're
exactly-
worried, is something wrong with this child? Is this child, what's happened? Is it because CPS has taken action and that child has been moved physically somewhere else? And when they call, they're getting nowhere. So we're like, do we need to be notifying the police? Like what's going,
Or
so
like
you
they
should be
show
able
up and
to.
do nothing and then something happened to, by
Yeah,
the parent.
so they're worried that, something bad has happened to that child and CPS isn't telling them what's happening, so they don't know if they're still in the custody of that family and something even worse has happened.
That is such a legitimate
Concern,
It's the
absolutely.
same
So
one
they
we
should
keep
be able to
hearing.
get that update.
I mean, we've been
Yes,
hearing
the
that.
child is not at school and it's
Right.
because, they're with another family member, they're
Yeah, they've
safe.
been
That's
moved
all we
with
know.
grandma and
We
pet
don't
or
need all the
something.
details
Yeah,
of,
right, they just need to know the very, very basic.
Yeah,
And I think that's multiple people have stated that. That they
Well-
do not, once they report, they have no idea, they do not know what has happened.
Beth will remember this case. One of the worst physical abuse cases I had at youth court was identified because of this exact same, except the teachers went to the house and knocked on the door.
wow, and the teacher shouldn't be put in that
And
bad
they should not,
situation.
and they saw the child with pancake makeup all over her.
Is that Lily?
Uh-huh.
We were just talking about it.
Video.
Oh, it's just the first name.
That child lived in our shelter for so long, we were so attached to her.
She was adorable.
She was adorable. But teachers literally
Right.
went to the house. But they should not be in that situation.
No, that's not a safe situation for
No.
the teachers.
Judge Alfonso, is it within the jurisdiction of the youth court judge to sign an order stating that once CPS lays eyes on physical abuse marks such as bruises, that then they can retrieve the other evidence that they think might be necessary for the investigation, such as grades or absentees or something that they have?
Absolutely, just put in the order. I mean, it's just a sentence or two.
So couldn't that be in the packet that the schools
Yeah.
have?
Yeah, just as long as it's standardized, everybody's following the same rubric, I think everybody would feel better that they're not violating something.
And so that's again, something you can bring up when you're meeting with the judges, the youth court judges. Because I'm sure the schools would appreciate it.
Because again, some of the schools are doing different things than other schools, so they just,
Or some schools say, yeah, we give out the attendance and all the other concerns, and
right from
some
the
don't.
beginning, and some don't, they feel they need to wait for that order so that they're covering their own behinds, just in case, because they don't want the parents to turn around and be like, and sue them for,
What's that?
breach of privacy. If it turns out to be unsubstantiated or whatever, so I kind of understand where they're coming from,
Yeah.
just to cover just have something to cover their tails, and they're more than happy to supply whatever information they need.
So y'all just took information, y'all don't have any more meetings with anybody in the school system?
At the moment, not at the moment,
I
we
mean,
just took information.
Yeah, literally we came from there, right over here.
So drafting a court order or a package is something maybe we can work on.
I think, first we'll
Well, I mean, they're gonna have to put it in the order.
Yeah, they'll have to do it,
But
so.
while we're doing a workshop with the judges, why not have
A form.
a draft so they can go, I
Who wants
like
to
that
work on
on the
that?
judge.
Yeah.
We'd like to work on that.
I'll do it.
I don't even know what they would do.
Tim and I'll do it. Maybe style it, release of necessary information, release. You know, undersigned judge authorizes the school to release blah, 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 blah.
Anytime they're making a CPS report. But they sounded like they really wanted like an actual packet with a rubric that they could follow with
Yeah.
all the policies and procedures. You know, this is how you gather the information, this is how you disseminate the information, this is the sort of information you need to be gathering. And then, like I said, getting some cameras for them to be taking appropriate pictures and having a way to upload that right with the initial report.
That camera's a big deal.
It is a big
Because
deal.
who owns that camera? And then you come right back into the privacy issues.
Exactly.
So having.
Well,
it-
I've never thought about that. I don't wanna put in a bruise of a child on my phone.
Right. But their point is they usually send these children to the nurse to have pictures taken immediately, because if you wait the 2 to 3 days for CPS to
They're
come in, it looks very different. So I'm glad they're documenting that stuff to begin with, but we need to have a standardized way of them doing it.
Well, and it needs to be in the standardized form, the date the report was made and the date that they came out. Because early on, I thought, well, you know, on a physical abuse case, they're going out there right away.
They don't.
But they unsubstantiated, they may have gone out 30 days later when the marks are gone.
Because
I'm
yeah, they have a
serious.
certain amount of time to do that, so it could be days.
Yeah.
Especially if it falls, you know, if they do that report on a Friday. They have so many working days to do it, so now you've got another 2 days added on.
So the nurses want a camera from CPS.
That was one of my suggestions, that they should have something standardized, yeah.
One of the, I think it was it the Biloxi one? Biloxi, that was, I forget what her name was. Because we asked about photographs and she said, well, you know, we don't have a camera that they can take photographs. They would have to use their personal ones, and they don't want to do that.
Yeah.
And I'm like, well, that just makes perfect sense,
Yeah.
you know?
The school could use.
school could
if
provide,
there's- Yeah,
yeah.
they could buy their own for their budget.
So it could either be the
School
school
owned.
board, somebody, but I don't know.
CPS could buy
But
one.
make it mandated, make it mandated.
CPS is not gonna buy one, but the school could. School, they're gonna tell us they don't have the funds.
There
Like
also
it's
may be an
starting
app,
to me,
because like at the hospital, we
Facebook.
use camera capture.
Yeah.
Anything.
Camera
What'd you
capture.
say? What'd you
That's
say?
true
I
too.
said there also may be like an app or something made for this, because at the hospital, we can use camera capture where
What
you
is
can
that?
take your pictures and it
So it's an
uploads
app
into a
on my
patient's
phone where I
chart.
can go in and take pictures of babies and then upload it right to their medical record.
Like you use
With
the
my
app
own
to take the
phone.
pictures, so it never saves to your phone.
That
So I mean, there may be an app that they could buy a subscription to or whatever,
called?
that they could use to do it.
It's through PowerChart, the one that I have.
But I mean,
I don't
it
know
may be
what
not that
theirs-
one, but there may be
Yeah.
There's
something
other
else
ones in
like
PowerChart.
An
that.
app?
Yeah, it's capture.
Camera capture is what
An
it's called.
app for photos.
But yeah, the thing
Upload,
where
right?
they be
You're gonna
uploading
upload.
it to,
And so then once
They
they
would have
have
to-
into it.
Yeah, I mean, it
They'll
depends on
record
what's
that.
placed out there.
Okay,
And then I take
Right,
pictures
right,
through
right.
it and link it to
Right.
the patient, and it goes right into their medical record.
Do y'all make call reports too, or just,
Do we make what? And then that's
do
per.
y'all go on and call the hotline?
I do the online.
Yeah.
Y'all
Yeah.
go
It's
to the
either
hotline.
where body was
You
picture
know, I'm so
was.
technically challenged, I make the hotline reports, and that is the most frustrating thing.
Yeah,
We
that's
have
what-
never made one.
That's why we don't.
Oh, the online one, I hate it.
No, the
Well, we do the
hotline.
online one, the hotline, they're.
Oh, the hotline.
The cookie.
Well, maybe like-
They are,
They'll, I was
say
told, I was like,
your
I,
report's not
well, I was
valid.
like, I was told she doesn't have her, she's telling me she doesn't have custody of her other 8 kids, and she's like, and? I was like, and she's like, well, I don't hear anything she's done to this one, I was like,
I haven't had a chance to,
It was
yeah.
it's an hour old. And she was like, basically was like, she wasn't gonna put it in. I was like, okay, have a good day. Like, I said, I will.
Jeannie, y'all were gonna have somebody come to the last meeting that didn't show up. Did you ever hear from her?
No, I did not. No.
Who is that gonna be?
Somebody?
Yes, it was someone that called me at the Advocacy Center and wanted to be placed on the agenda, and I placed her on the agenda, and she did not show up.
Her experience with CPS.
Well, I think that what she stated was that, she was never notified of court with youth court, and things happened and she had no idea. So I don't know. Okay, what else?
All right, trying to turn my phone back on. So,
Lauren, did social service, did they give you any updates for the hospital numbers?
They did not.
They've been reporting, the reports that they've
Just
made.
the number of
numbers.
CPS cases.
I'm sorry, what?
Because we had seen a trend last year where the case numbers were going up, but the number of CPS, people that's been taken into the CPS custody was going down.
Yeah,
Okay.
Who's gonna do that? That was Cindy was
Cindy
doing that.
is the one that should be doing those.
So how do y'all keep up with it? It's just, because I'm like, we all kind of do.
Well, because we report all of our positive drug screens and any concerns to social services, and they report it
Okay,
all.
so
So
social
they have, social services has the numbers.
Gotcha.
Who they report.
Yeah, we like to have the numbers of how many reports that, that they have made in a particular month, that they've been keeping records.
Yeah, we'd love to have it from y'all too.
Yeah,
You know.
please send it to me. You
I
have
don't
it?
know, I'm just
not-
trying to think of how can we, because we all, like, between the.
Y'all all are doing reports,
Yeah.
you don't
You don't
have
have a
one.
central.
one single, yeah.
Do y'all have social service? I mean, y'all have,
Like, they're more, I don't know why they don't really do our side of the hospital. They do a lot with the adults.
Yeah. Like even some of the like the med feeds that cover, they say like it'll be like the same worker. So, like they don't treat me like this with my adult patients, but with a kid, they just like I mean I don't know. They just kind of it may used to be
We don't know
because we've
why.
always done it, but they just don't. They'll put in like a social service consult, and they'll just be like, did y'all put that report in? And we're like,
So you keep track of the calls that you make to CPS?
I mean,
No.
not tally wise, no.
Because, I mean, there's a lot of them. We chart it,
Mm-hmm.
put it in
We
your
have the
chart.
confirmation number, and I have
Always
a running,
chart it.
I have a running note.
so if we ever need to go look back at something.
But not the report.
Can that populate that? Can the electronic chart
into a number?
populate that to the number?
Well, if you've got a running list, I guess you could just break it up.
Yeah,
into
we-
lists. And that's all it is, it's just a
Yeah.
number, it's just a reported number.
We need to start doing that.
Yeah, if you would, we would love to have that.
Yeah.
We could put it, it would be interesting for us to have that number.
I don't know how they would do it. Y'all would just have to individually.
Yeah,
Maybe
each
like
time
they
they
do something
I think
for
they keep it
confirmation.
do you keep it manually? Is that what you're saying?
No.
No,
Just
we
put
don't
it in the
now.
chart.
I only keep a running list in my head of the ones that have been sent home positive for like fentanyl
To
and
check
meth.
on.
Oh, I
Check on,
see, I
like,
see.
have y'all had court on this one yet? Because I
I
know,
see,
because I
so you
know the
don't-
judge doesn't like, because whenever they do the random now, very few times they take custody, she doesn't even like let visiting out like if they're positive. So I'm like, I know that if she knew about these, I don't think that she would be. So I just always wonder, have we made it to court yet? You know,
Okay.
because that doesn't sit right with us. But no, we need to. I'll figure out how we can maybe,
Yeah.
even if it's something epic of like checking something that triggers like CPS report
It'd
made.
just be an interesting statistic, because what we found
That's
is, Memorial is making a lot of reports.
Yeah, we have it
We
built.
do too, so.
I mean, we can run reports from Cerner, so I would assume if you just chart it in one specific place, you should be able to run a report
Okay.
that like monthly would
Yeah.
give you a
Yeah.
total or something like that.
Yeah.
Like, do y'all just do like a narrative though, like CPS notified of blah, blah,
So
blah,
we
or like?
have it built as a consult in, and then we also have safety concerns that the nurses can document on, and if those safety concerns are documented on, it's an auto report to social services.
So they
So
can
they
update
get
the
that
system.
based up.
CPS reports that we already have now.
I had that built for all the problems.
Yeah, that's a great idea. Because that's one thing, we were documenting in different places, the nurses, and then it wasn't getting to social work, so the social work wasn't reporting it to CPS. And so even though we had all this extra stuff after the initial report, CPS wasn't seeing any of it. So that was one of the breakdowns that we identified, and we were able to get
Well, and
that.
this may be a good time to like go back to your facility and try to like have a meeting and get a better plan. And
Yeah.
like, we started, meeting with our social worker daily and going over every
Like Monday through
patient.
Friday, not on weekends,
Yeah.
but.
And going over every patient, like, are they discharging soon? Do they have any needs? Do they have any concerns? And so we can more quickly identify and be on top of who has problems that we need to be addressing kind of thing. And then just having one person to report is, I think, makes a really big difference,
Is
because
that
then
Cindy?
it's consistent.
Cindy's like a
and it's,
supervisor,
you
there's
know,
somebody underneath her, Delisa, that does,
Honestly, one time we tried to do that where it, so there wasn't confusion and trying to say for social, and it was a whole like,
Not good.
yeah, animal, like, then it was very, it was like,
Bad.
very.
When you're trying to make someone do more than they usually do, and so whether
Then
they're
like-
just like, don't worry about it,
Yeah.
we'll do it ourselves. Because how are,
They'll like
who
post
knows?
flyers, they'll like highlight anyone, the first person who recognizes signs of an issue is responsible for the report, you know what I mean?
so
So,
then
then-
nobody's sitting there
right,
singing.
so I'm like, okay,
Yeah.
we'll just do it, that way we know it's done, and
Yeah.
so. But
Okay,
maybe
so
that's
yes.
like the,
That does need to be improved.
incorporating like something on the EMR would be.
Well, guys, we have gone over.
The good work of the committee is getting around, because I've had several people, and I just wanna say y'all's good work is getting around, because I've had several people that have approached me about doing this for adult protective services. Because adult protective services is as bad, if not worse, than children's services.
That's a good point. And elder law doesn't seem to be something that's really practiced a lot in our area as far as a focal niche.
And there's so much stealing from the elderly, it's rampant. It is rampant.
Well, we
Do
have,
you all have any objection to me inviting Tiffany Gillot? Do you know Tiffany? She works with abuse and neglect with Harrison.
she is wonderful.
Yeah, and she comes to all of my meetings. I think she would be an asset to this group.
I think she would be wonderful to come
I'm
and
gonna
talk.
give her a call.
Tiffany.
Tiffany. She is amazing.
So,
Ladies, I'm gonna have to be excused. Y'all are welcome to continue, but I have a
Are
family
we
member
adjourning?
I've got to.
Okay,
Yeah,
adjourn.
we're adjourning. Oh,
I'm going
oh,
to.
okay, I'm sorry.
I need someone to make a, motion, please, to adjourn.
I'll make a motion.
Second,
Yeah.
vote, aye.
Aye, thank you.
Unanimous, thank you.
Thank you,
So the
Kim.
next meeting is April the 11th?
That's
Yes,
correct.
Because it was changed several months ago because
Of
of
Easter.
Easter.
Ken, I'll give you a call and we'll start working on some of this.
Thank you, ma'am.
About,
Appreciate
that.
I'll explain to you.
Just two separate.
Yeah. Okay.